Whiplash is an injury to the neck caused by sudden hyperextension and hyperflexion of the neck. Sudden hyperextension, sudden hyperextension followed by of the neck followed by the hyperflexion or vice versa. A wide range of neck injuries are seen, including fracture and fracture dislocations, which are sometimes referred to as whiplash-associated disorders also. Silent features first described by the Harold Crowe in 1928. The rule of the thumb regarding spinal cord injury is rarely injured without associated fracture of the vertebral column. Whiplash injury is a general exception to this rule, as in severe cases, spinal cord is injured without associated fracture. So, without associated fractures, the spinal cord is injured. Mechanism caused by sudden and violent hyperextension, hyperflexion, and hyperextension of the spine. Of these two, hyperextension is more dangerous because flexion injuries are protected by the contraction of strong posterior neck muscles in comparison in the anterior longitudinal ligament, which protects from injuries during hyperextension, is quite weak. Injuries, that is dislocations of upper cervical spine, dislocation of the upper cervical spine, fatal contusion and laceration of spine without the fracture of the spine. The fracture, dislocation in the lower spine, that is C5, C6. Fracture dislocation in upper dorsal spine, T5, 7. Causes is motor vehicle accidents, most common, or stationary vehicle struck from rear, most common. Causes sudden hyperextension of the head followed by sudden flexion to prevent hyperextension. Modern cars have a headrest at the top of the seat. The moving vehicle crash into a stationary object. Hyperflexion of the head strikes windscreen, rebounds, goes into hyperextension. Next is about rabbit punch. That is a sharp blow to the back of the neck, spinous process of the upper cervical vertebra or the base of the skull. Because of the fear of whiplash injury, the rabbit punch is illegal in boxing and many other combat sports. The name is derived from the use of the technique by hunters to kill rabbits with a quick and sharp strike to the back of the head. Clinical presentation, that is, will be cognitive and psychological symptoms: dizziness, headache, neck, shoulder, back pain, paresthesia, vertigo. This symptom persists for 1 month. It is known as chronic whiplash injury. Thank you.